Thank you, Madam Chair and members. Today we're here to ask the committee approve an audit on the Department of Mental Health Sex Offender Commitment Program. Many communities have unfortunately been touched by violence and heinous acts by violent sexual predators, and unfortunately the recent cases in San Diego are just the latest to fall prey to these types of criminals. Many of you are familiar with the case of John Albert Gardner. Gardner was a sex offender convicted of violently molesting a 13-year-old girl in 2000. He was released after 5 years in prison and recently pled guilty to the brutal rape and murder of 2 separate girls from San Diego that occurred shortly after he completed his time on parole. These events have led to a full-fledged review and evaluation by a number of people. Our office, in coordination with some of the families, Senator Nielsen, the Sex Offender Management Board, and many other folks who have worked on these issues for many years, DAs, sheriffs, legislators who've had a commitment, all in an effort to examine every facet of the criminal justice system, but in particularly how it handles sexually violent predators. The goal is very simple, to find every possible way to protect children, ensure justice, and promote public safety. From the prosecution and sentencing of these individuals, which we've looked at, CDCR, parole processes, the various medical evaluations, post-parole registration and tracking, the Static 99 evaluation system, we're trying to take a look at every mechanism our state has to safeguard the public from criminals. Is being examined, is being reviewed in an effort to see how do we improve the system. The Department of Mental Health's Sex Offender Commitment Program is a very important piece of the overall public safety system. This program is charged with evaluating sex offenders to determine if they have a diagnosable mental disorder that makes it likely they will engage in sexually violent predatory behavior upon their release into the community. It is the key to really assess the propensity of someone to reoffend and to make sure we properly prioritize and focus on those that are most dangerous, that are most likely to reoffend. This audit is part in response to a number of questions that have been raised. There's been press reports, whistleblower accusations, and other information that suggests there may be deficiencies or there may be areas of improvement within the current system. I believe in general we have to do a better job of prioritizing our resources on those that are the most dangerous, that are the most likely to reoffend. And this program, as I mentioned earlier, has I believe the opportunity to be a key and integral part of that effort and prioritization. If diagnosed as a sexually violent predator and confirmed by a court or a jury, that individual is committed to the custody of the Department of Mental Health for appropriate treatment and confinement in a secure mental health facility. We believe examining these offenders and keeping those who are most dangerous out of our communities is of utmost importance, which is why we've requested this audit. As legislators, we need to know which programs are running efficiently and where there are potential changes in order to make it work more effectively. The goal is not to cast blame. The goal is not to point fingers. There's nothing at all we can do to bring back the victim of a past crime. But we have an obligation to do everything possible to ensure we have a system that protects our children. There are several questions to be examined. So many of these are outlined in the materials we provided, but in particular we're interested in the Department of Mental Health if they're using appropriate protocols when excusing certain offenders after level 2 paper screenings. We have concerns about the paper evaluation versus the in-person evaluation and making sure that that's being done properly. We're interested in what are the credible reasons as to why the number of civil commitments has decreased, even though the number of referrals from CDCR has increased tenfold. In particular, 2 years, from 2004 to 2006, there were less than 3,000 referrals from CDCR to the Department of Mental Health for this program. Out of those 3,000 referrals, 71 of them were referred for commitment under this program. From 2007 to 2009, there were over 22,000 referrals, yet there were only 59 commitments. We would like some more information and have that looked into. We're interested in the current process for bidding and contracting out. Psychologist working. Is it working to the detriment or is it working to the advantage of the current system? And there's some other issues that have come up that I think will be interesting as we move forward through this audit or others. It's estimated in materials from the Department of Mental Health that 40% of the offenders refuse to participate in the in-person evaluation. Was there some way that that can be weighed into their likelihood to reoffend or the scoring system that they get? There's also been some very interesting academic work and other states have done as it relates to polygraphs, and I think in some form those are appropriate to look at as well. It is our hope that this process will help improve the department, will help improve the system and will better protect children. I've met with the Department of Mental Health, and I want to say I appreciate their tone and their efforts. Unlike other state agencies that are involved in public safety or other state agencies that are, say, involved in corrections, that seem focused on defending the indefensible and refusing to be a part of a solution, I would like to say that the Department of Mental Health has had the opposite tone. They've welcomed the audit, they've welcomed the approach, and I think that as we go through this, they'll have some constructive solutions on how we improve the situation. I think for that, they should be applauded. This audit is a good first step, and as I mentioned earlier, there's a broader effort we're doing, but we think this is a very important program, and we think when there's areas for improvement, refinement, better prioritization, we have to do everything possible. And so I respectfully request an aye vote.